Good morning, everybody. I'm here at my fantastic, amazing doctor, neurosurgeon, Dr. Lizet Louw-Marias, and she agreed that we can actually record my visit today. I've had back surgery on the 1st of November, and I can't remember how many visits after that I've had, but just a normal checkup. And Doc, thank you so much for having me today again, seeing me today.
It's a huge pleasure.
You didn't expect to be recorded this morning, but thank you so much. The reason why I'm recording this, Doc, I've had an amazing experience. There's so many people, especially the last 2 weeks, people that I've seen on social media saying, I'm scared of back surgery, my back surgery was not successful. You mentioned the one day, the first time I've been here, that during your studies, they taught you guys that more than 50%, also about 50% of back surgeries usually are not successful. You've got a different viewpoint. Why is that?
So back surgery is a controversial matter outside. People have the idea that it is not successful. I've had many patients who heard from their GP that said, work until you can't anymore and then you go for surgery because you will have persistent pain afterwards. And I've seen a different experience in my practice. I think it's very important to note that initially you have to get an accurate diagnosis of what is causing your pain or what is causing your problem before you even do any imaging. Because if you don't start off at that point, you are having a risk of getting the wrong surgery done. So it's important to note that there's different structures in your back that can cause symptoms. The spine consists of the bones. They've got little joints in between them. They've got the canal in which the nerves run. And at each level, there's nerve roots exiting at each level. And all these structures can cause problems. This includes if you have an instability in your spine, meaning there's abnormal movement between the bones, then it can cause pain or even signs of nerves that's unhappy. You can have problems between the little joints, between the bones, that's called the facet joints, which can cause a different type of pain. And then you can have nerves that's unhappy. And it's important to note that the whole nervous system is connected to each other. So whether the problem is in the brain, in the neck, or in the spinal cord, in the upper back, or in the nerve roots at the lower back, it's important to have a full evaluation. Because if you may have back pain, but the cause might be in your neck, and if you only focus on the lower back, then you might get surgery there because the spine looks abnormal on the MRI, but it is not the cause of the pain. So an accurate diagnosis is important. And then also to determine exactly what is causing the problem when you look at scans afterwards. That is important. Because if you just look at a scan, you can see many abnormalities there because everybody's spine is aging. But it's not necessarily the cause of the problem. That's why starting off with what is the problem and then finding the cause is the best approach. And then also there's different ways to address certain problems. So I always try to do the minimum that is required to manage a problem, because not everybody requires instrumentation in their spine. Some people do. And if you do put instrumentation in unnecessarily, you may have problems later on because you've caused stiffness where it wasn't needed. But in your case, you did have instability in your back.
I'm going to quickly pause you there. That's okay. So when I came to you, Doc, you were the second specialist that I've been to. I've been to somebody else previously. It doesn't matter who it is, but there's a human behind the doctor, and that is what got me. And I think that's a big, massive lesson for so many doctors, especially out there. The previous doctor that I went to see looked at my back, looked at the MRI scan. He didn't have such a thorough investigation. As you explained now, you need to find out exactly what's the cause, blah, blah, blah. It was a quick in and out. He looked at my MRI scan, and a question that I had to him was, will I be able to run again? And he looked me in the eye, and he didn't blink, and he said to me, no, and you will have to change your lifestyle completely. Back surgery is not for me. I got up and I walked away, and my aunt convinced me, and she said to me, you need to go and see this Dr. Lizet. She's amazing, and she had wonderful feedback from friends of her that came to you. And then about a year later, I decided, well, I'm going to come and visit you. And from the moment that I walked in, your energy, your positive thoughts, your mindset, everything, it's just amazing. And what I remember, what you said is so true. What I remember was, you said to me, you always try to do as little as possible. I might not even have surgery or need surgery. But then you looked at my previous MRI scan and you said there might be a small procedure. And you'll remember then we did a new MRI scan because I had to. It was more than a year between the MRI scans. And the end result was I needed to get surgery. But I did ask you before the surgery, before we decided that I'm going to have the procedure done, do you think I'll be able to run again? And the way you reacted will stay with me for the rest of my life. I'm a very positive guy. Most people know me very positive, but you had no doubt. You couldn't give me a 100% guarantee, but you had no doubt that I'll be able to run again and live a normal life. And here I am. I think it's about, 7 months later, and I've got a better quality of life, quality of living that I've had in the last 10, 15 years. It is just wonderful. So your positive mindset and the person behind the doctor. I mean, I came here a couple of times. Myself has been in the hospital with a surgery. My wife, Andrea, she was pregnant. She had the baby delivered here. Mom and Dad has been here in the hospital as well. And during that time, I bumped into you a few times in the corridors. And every single time, you remembered me, my name, Andrea's name, the little baby's name, all the small details, things that's not related to why I'm here. And the person behind the doctor is just amazing, and that makes such a big difference. You don't get that from the average doctor out there. So, wow, thank you for that. Just quickly, if that's okay, I don't want to take too much of your time. There's other patients waiting as well. Please just quickly explain again what you've done, the procedure for me.
So you had instability in your back. So there was movement between the lower lumbar bone and your sacrum. And what I did for you is I did a fusion between the lower lumbar bone and the sacrum. I put in screws and these little rods in between to stabilize that segment.
Unknown caller.
It happens. There we go.
But I put the stability in place, and that caused the movement not to happen. There was also compression on your nerves at that level, so that compression was taken away. And at the end of the day, your nerves are not being compressed anymore, and you also have stability. So and that just proves that if I only decompressed the nerves, we wouldn't have had the results, because you do have the movement that was abnormal.
If I may say, the last 2.5 years before the surgery, every morning when I woke up, the pain was so severe. For a big part of my life, I didn't tell my wife Andrea about it. I tried to hide the pain, call it stupidity, call it whatever. I didn't want her to know because I didn't want to put that stress on her as well. But in the mornings, to get out of bed was the big struggle. Sometimes it took me half an hour to get out of bed. A lot of people, and I was like that as well. The moment you hear the word fusion, people tend to think, oh no, you're not going to have any mobility or anything and your life is going to change completely. I do not feel any difference compared to 20 years ago in my back. I'm more flexible than ever before. I must say, I listened to you. You told me exactly what I needed to do, how, what, when. I followed that. I think there's three things. Number one, obviously, the grace of God is the biggest thing.
Absolutely.
You can't go with, and that was part of the conversation since the very first meeting or visit I had with you, Doc. Obviously, number two, amazing, superhuman specialist. And I think the fact that I looked after my body fairly well before the surgery and I followed the rehabilitation to the point exactly what I had to do, all of that does make a big difference.
Absolutely.
So yeah, it is, don't be scared of back surgery. Make sure that you see a great, fantastic doctor. Always put God first. And I think I did tell you this, the night before I went to hospital, I asked Andrea, so when you go to hospital, what do you pack? And she said to me, underwear. I said, yeah, obviously brass panties, all of that. What else do you pack? And she said to me, no, obviously pajamas for the first night, pajamas for the second night. And I said, that is where I'm different. And she said to me, well, I said, I'm going to pack my running shoes, but I'm going to visualize how I walk out of the hospital. And that was exactly that. So also what got me, I didn't realize that I'm going to come and see you a couple of times afterwards, because in the past, and people that I spoke to in the past that surgery, whether it was back or anything else, and they went for one follow-up and after that never spoke to the doctor again. I've been here a couple of times after that. Do you always do that?
Yes. So important is before we decide upon surgery, I always start medication to see if we can get the symptoms better with medication or not. In your case, that was not successful, and the movement aspect at that level was not something that was going to go away.
At that point, it actually got worse.
Exactly. Yeah. And the point is, the medication that I give for nerve pain, I do not stop immediately because the nerves are still recovering, and it's difficult to predict how long it's going to take to recover. So I don't stop that medication immediately. I taper it down slowly, and at the end of the day, we stop that. But it's a trial and error basis of how quickly we can stop it and how quickly we can reduce it. So until you are off medication, and I'm happy that you will function normally outside, I still follow you up.
It is amazing. A lot of people tend to think that I've hurt my back for all the crazy things that I've done, running events and cycling events and all of that. But I believe my problem started many, many years ago in 1999 when I was in a motor vehicle accident, and I know I've hurt my lower back then. Throughout the years, I knew how to exercise and do exercises to improve that and to prevent the pain, but slowly got worse and worse and worse, up to the point where I had to come and see a doctor. I was always scared. And the reason why I'm recording this is for all the people out there that's got a problem, don't be scared. Do something about it. Go and see somebody like a Dr. Lizet, somebody that, number one, cares about you as a person, that doesn't just see you as a number, but as a real human being, not even as a patient, as a real human being in front of you. Somebody that really want to improve your life, your quality of living. If I think about my entire experience, from the day that I walked in here, and I want to start at the reception of Jolene especially, everything, I mean, this morning again, every time I come here, I have the best coffee ever. I probably look forward to the coffee more than seeing you, Doc, to be honest. But the entire experience, the professionalism from the reception desk, the phone call, the phone call reminders, the way they dealt with my account, every single thing was just more than special. And it really does go a long way. Don't be scared. Do something about it. Find a great specialist. And then make sure before the surgery that you get your body in the best possible position to recover from a surgery if needed so much quicker. And then obviously that rehabilitation. The physiotherapist that I worked with, John, that helped me as well, my own knowledge and experience that I used obviously, but the rehabilitation is extremely important as well.
Absolutely.
I can only say thank you. We didn't even got to my reason for being here today, and that's my appointment today. I'm just going to tell you, Doc, that I feel amazing. I feel great. I do more now, and I live a completely normal life. I'm at the point now, I maybe shouldn't say this in front of my doctor, but I don't even think about my back at all. When I lift things, I don't think about it. I don't feel it. I'm not stupid. I'm not crazy. I do what I need to do. Obviously, I won't jeopardize what I've had and what's been done, but to live a pain-free, normal life, it is absolutely life-changing. So don't be scared. I can only thank you, Doc. So yeah, thank you for your time, and thank you that we can actually record this.
It's a huge pleasure. And I also want to say that in my practice, my goal is to improve people's quality of life. We can't always correct everything 100%, but that is the goal. So even if the pain is better and you can function better, that is the goal.
Of course, I actually got goosebumps when he said that, because that is exactly what I experienced. It's I cannot say that enough. I think your qualities as a neurosurgeon is fantastic, but what's even more important is the way that you really strive to improve people's lives. It's just not another paycheck. It's not just another number. And sadly, I've had that many times in my life before when it comes to doctors, but it is the complete opposite. So from the bottom of my heart, thank you, God, but thank you, Doc. Wonderful. And if you want to find out where to contact this lovely doctor, inbox me.